Yeah. Good evening, everyone. My name is Dr. Sachin Gupta, and I'm co-founder and chief operating officer of Whitehall Hub and Physician VC Singapore. On behalf of our founding team and management, I'd like to welcome today's distinguished guests, investors, delegates, startup founders who are joining us from across the world for this session titled "Physicians at the Epicenter of Healthcare Innovation." Healthcare innovation, as all of us know, has taken a center stage globally over last 1.5 years, and physicians are at the forefront. They are not only COVID warrior, but they are doing uh, beyond just taking patient care. Same time, governments across the world, they are also acting very fast, working hand in hand with private sector stakeholders to catalyze innovation in healthcare. Earlier this week, we saw Prime Minister of India announcing Ayushman Bharat Digital Health Mission that will enable quality healthcare uh, to be accessible to all Indian citizens. Similar steps are being taken by governments across the world, and healthcare innovation and entrepreneurship system is actually uh, getting a lot of traction. Today we have, and at Physician VC and Whitehall Hub, our team sincerely believes that physicians are the one who are at epicenter of all sort of healthcare innovation, as well as they are the driving force, catalysts. They are at the center of it. To discuss this, we have a very eminent panel of physicians who are reputed and known globally, who are joining us to discuss this. So I'll introduce one by one, starting with myself. As I said, my name is Dr. Sachin Gupta. I did my MBBS from Government Medical College Patiala, followed by an MBA from National University of Singapore. After which I worked with a company called IHH Healthcare, which runs hospitals under brand name Fortis and Global Hospitals in India. I was their sole business representative in India from year 2010 to 12, followed by I started Celis Healthcare Resources in 2013, and in 2019 I was appointed as advisor to ICMR to help them set up Center for Innovation and Biodesign at campus of PGI Chandigarh. In 2020, which is last year, I joined hands with my co-founder Zafar and Dr. Rahul Garg, who's based in Singapore and Toronto respectively, to launch this innovation platform called Whitehall Hub. Later on, we were joined by Dr. Arpan David, who's our partner and chief investment officer. Dr. David has worked as CEO of large hospitals in Middle East, and nowadays he's based in Singapore. He'll be the one who will be moderating today's discussion. Dr. David has done his MBBS from CMC Ludhiana, and then postgraduate program from Apollo Hospitals. We we also have Dr. Sanjeev Bagai, who is a Padma Shree Awardee and BC Roy Awardee, and one of the most known names in field of pediatric nephrology in India. He's also one of the foremost physician voices in the country. Then we have General Jagtar Singh, who was Additional Director General of Armed Forces Medical Services in India. He is a Vishish Seva Medal Awardee and was also Medical Director at Apollo Hospitals. And we have Dr. Rahul Bhargava, who's Group Principal Director for Bone Marrow and Stem Cell Transplant at Fortis Healthcare. We also have Dr. K Tripathi, who is Head of Nephrology at Artemis Hospital in Gurgaon. Yeah. So this was the panel, and now I hand over this discussion to Dr. Arpan David. Dr. David.
I was on mute. Thank you, Sachin, and again, a welcome from my side for all the esteemed panelists. And I'm sure all our member physicians and audience are keenly looking forward, as I am, to get your candid views on the topic that we have today. So what I'll try and do is I just share a few numbers to give you a bit of a backdrop of the size of the industry and the kind of investment we're looking at in health tech in general, and also the size of the market going forward. As you all know, in the last year, we've seen a lot of growth in the industry. I mean, the investments that went in globally for the first quarter of 2021 were close to 20 billion plus US dollars, which is almost double what it was for the same period last year. In Southeast Asia, the investments have grown at a faster rate. So what used to be a $1.5 billion investment in quarter one of 2020 was 4 billion plus in 2021. So there's a lot of action in this sector. And also a recent McKinsey study also highlighted the size of the technology-driven healthcare digitization processes, transformation of services, including diagnostics, growing from about 40 odd billion to almost 100 billion plus in the next 4 or 5 years. So this is the backdrop, the kind of growth that we're looking to see. Everyone's been talking about it. There's a lot of innovation happening, not only in terms of nascent innovation, but also in terms of the way we deliver services. Beyond telehealth and e-consultation, which was always there and gained a lot of prominence. So I want to open by asking you, and maybe we will start with Dr. Singh and then Dr. Bagai. What do you think physicians should be at the epicenter of healthcare innovation? That's my first question. Should they be at all, or should they not bother with this?
Thank you, Arpan. First of all, it's a pleasure to be a part of this very distinguished panel, and a very interesting, I would say, initiative that is taking place now. So, and I would say that your question is also very, very relevant as to should the physician be the epicenter of the healthcare, digital health, or healthcare innovation. First, let's look at this word epicenter. What does it mean? Epicenter means actually the central point of something which is typically difficult, or I would say trying, but I would add also interesting. So in that way, I feel the physicians are always, as far as healthcare is concerned and as far as care of their patients is concerned, in all its dimensions, they are the central point. And they always have to take the ownership of whatever their actions are as far as healthcare delivery is concerned. Now, whether that would actually mean, should they be initiating the efforts as far as healthcare innovation is concerned, or should they be leading these efforts or these projects, or should they be only contributing to it in the form of ideas? I think it can be all. But in all this, I think the doctors or the physicians play a very, very significant role, as with basically, I would say what matters is what is the aim. The aim is always, as far as the healthcare physician is concerned, that it should enhance, any healthcare innovation should enhance the patient experience. That's very, very important. Secondly, it should improve the health of the patient. Thirdly, it also concerns them if it can reduce the cost of care for their patients. And lastly, I would say what is also an important thing for the physician to be the epicenter, it should improve their work life as a healthcare provider. So that's all I have to say at this, your question at this stage. Thank you.
Thank you, Doctor. And that kind of touches on all the major issues involved in this. Dr. Bagai, what would be your views on this?
Okay, so to begin with, thank you, the organizers, for having me and all of us. Wonderful to talk to all of you all. To answer your question, the answer is an emphatic yes. I think the physicians are going to be the cornerstone of healthcare delivery system, right from the conception stage, pre-planning stage, going onwards, in not only in healthcare delivery systems. And I think this change is going to be even more rapid post-pandemic. It's going to be more physician and clinician driven. But before we actually make this emphatic yes into an overwhelming yes, we have to make certain changes, at least in the Indian healthcare scenario. One is the doctors as a team must have a very active role in the pre-conceptualization stage, much before the construction starts of newer hospitals, at least, or revamping of the hospitals, right from the medical layout to the equipment planning, the digital smart technology layout, and the integration of seamless connectivity. So I think the physicians have a very key role, even though you may have the best designers and the best architects and the best MBAs. But I think the heart of the hospital, really, the soul belongs to what the doctors would require clinically. When you're looking at to build this kind of platform, I won't delve into the details, but I'll just give you the key points. I think we also, as a nation, need to look into our curriculum, which is producing the doctors. When you are looking at a curriculum which is producing the doctors, the MBBS syllabus needs a real 360 degrees overall. We need to include things of data analytics for young minds. Most MBBS students who are coming out of it are groping with it. They are not confident in it. We need to include a great emphasis on public health, and we need to include something which is going forward is on the digital smart technology side, and to have an option right at the MBBS level in medical colleges, be it private or in government, as a 1 year or a 2 year add-on MBA. I think the business dimensions going forward is going to capture the heart and minds of most young students. So I think this should be encouraged. It should be an option in between MBBS and MDMS, or between MBBS and MD, and then going forward you can do an MBA. Now, coming to your question more in little bit of detail, I think any technology or any innovation has to address four key points. One is clinical excellence. Two is operational excellence. Three is patient experience enhancement. And point number four, the delivery system must be cost effective. Meaning to say, in Indian scenario at least, we have to move from affordable, accredited, and accessible healthcare, the famous 3 A's which we've been singing for the last 2 decades in India. But now we need to move towards personal, primary, preventive, predictive, and proactive healthcare. And how do we actually do this is through smart innovations, what we call as digital smart technology. I won't go into the statistics right now. During the course of this talk, we can share more details. But the point really is, can we give healthcare to a patient without a patient being overwhelmed in a hospital setting, without being intimidated in a hospital setting? The patient-friendly experience is experienced by the patients at a cost-effective rate with seamless connectivity, various advantages to get better clinical results. And in the end, in this segment, what I would like to add just one point is, it's a question for everyone. Has anyone ever wondered that why government hospitals, or indeed more so private hospitals, never publish their clinical results on their website? And I want to stress on this. There is no point in saying that a particular doctor has done 500 cardiac surgeries or 300 renal or liver transplants. On the website should be published what is your year-on-year mortality and morbidity rate, graft survival rate, say, for example, or patient survival rate. That's the proof of the pudding. I mean, the detail and the devil has to be approached. Over to you.
No, very valid points, Doctor. Thank you for that. I think the MBBS revamp is something that has been on the cards for a while. And also, the point is really well taken with regard to outcomes and experience. So I think these are going to be key drivers of any kind of innovation going forward. I want to move on to Dr. Tripathi and Dr. Bhargava. Both of you are extremely busy practicing physicians in the private corporate healthcare sector. So from your own point of view, how do you see innovation? Is it something that is part of what you can do? And even if we answer the question that yes, physicians should be at the epicenter, How do you see this? How do you see yourself engaging with this kind of innovation? And is there an environment for this to happen? Maybe Dr. Tripathi, I could come to you first, and then Dr. Bhargava, you can add on.
Thank you all for including me in this panel. As taking ahead from Dr. Jagjit Singh and Dr. Bagai, who have already enumerated the main points, from the private sector point of view, we at Artemis, like I can give my example of my hospital. Then we are right from the beginning, we are trying to make our paperless hospital, and this digitization was our forefront area. And now we are witnessing the changes and the need during the pandemic. Also, we got its benefit prudently by using our resources. And as you all know, like during pandemic, the online consultations have taken a on first hand. And with this area of digitization and electronic records, and Dr. Bagai rightly said that we must publish our data, so that data is new gold, as said by many people. So unless we have data, and since beginning we are recognizing this fact that even most of the hospitals are not giving their data, even private or government setups. And we are in ISOT registry, we are trying to get data from for all the transplants, cat blood transplants, but people are averse to the idea, and they are not communicating properly. So this is major area of concern. So unless we have data, we cannot go for, we cannot, you can say, make the policies, and effects are not well taken. So the other area of concern is, you can say, the patient-centric approach, which is already there. But what we need to do again is to communicate with them better, because there are many instances of miscommunication, or you can say there are problems. Patients do not understand what are our intentions, and sometimes there are fights over many things, petty things. So these are also other areas of concern, because with online consultations and online, you can say, online delivery of the healthcare systems, there must be there will be some major problems also, because with personal care, the patient and doctor were very much closely associated. And the even communication wise also, the things which were not being understood was being done with multiple sessions of communication. But with online consultation, it is not possible. And sometimes you give a message which is wrongly recognized by the patients or the party, and then they allege that this is not proper, or this was not being done, and this was the negative approach. So with this, you can say, infodemic or dystodemic, what is associated with the pandemic like situation, or we can anticipate, or we have to anticipate the problems also. Because without anticipation, you cannot, like this second wave, we have also have seen that we were totally told up stage. So this anticipation of the problems which may come with the digitization and online consultations is also major concern. As also said by Dr. Bagai, that we need to revamp our curriculum, not only at MBBS but also at you can say PG and post PG states. We are teaching hospital with DNBs in super specialties and specialties, and they have also major area of concern, because they are with families, and they need to devote the time to the families also. And with it, we have seen during the pandemic, we were also doctors were also not even they were being barred from entering their societies and other things. So this is social problem. But with this all sort of medical advancement and technical advancement, we need to include these social problems also, and we need to anticipate them for their proper answers. That's all.
Valuable points there, Doctor. I think the practical aspect of it and the social aspect of innovation is also something that we need to keep in mind. So while we keep looking at it as providers of care or even technologists, there is a practical element on the ground, and of course there are real people involved. So definitely very valuable points. Dr. Bhargav, so back to, I mean, doctors in the private sector are extremely busy seeing patients and largely spend their time pretty much 16, 14 hours a day with that. How much time do you think they have for innovation? And we say that doctors should be front and center, epicenter of healthcare innovation. How can doctors in the private sector get better involved with this? And
Arpan,
what do you think they can do? Sorry, yes, please go ahead.
yeah, Arpan, thanks for being on me on the show.
Yeah,
Dr. Bagai has set the goals. Let me talk about
yeah,
the journey.
yeah.
So understand the conventional model of the delivering the system can never be amplified, can never be
Hmm,
scaled up.
hmm,
I might be a brilliant doctor.
hmm,
Dr. Tripathi is a brilliant doctor. Dr. Bagai is a brilliant doctor. How many clones can you have in a day? What is his capacity? Dr. Pathir is there. He's a brilliant surgeon. He can do 5 surgeries, 6 surgeries in a maximum in a day. But can
hmm,
he do beyond that? So the
hmm,
biggest problem in India was one
hmm,
is of course the population which is there.
hmm,
Second, we never thought as a healthcare provider how to scale up your skills so that
hmm,
it can be delivered to the larger benefits of people.
hmm,
Health plus technology. Dr. Bagai spoke about changing the curriculum. Great. Of
hmm,
having a business side of it. Let me bring
hmm,
a technology side of it and give you an example for this.
hmm,
So one of the guys invented a point of care device for a hemoglobin checker for the masses.
hmm,
Now the hemoglobin checkup can only tell you whether your hemoglobin is less than 10 or not. Great.
hmm,
Great device. 65% people are anemic in this country. Great.
hmm,
But can it tell you what is it iron deficiency anemia or not? Because if the hospital or the doctor would have collaborated with the IITN, he could
hmm,
have understood that with a prick of a blood, he could have
hmm,
counted the MCV of those 4.5 million RBCs through lasers in a point of care device and could have led to differentiate between iron deficiency anemia, thalassemia, or megaloblastic anemia, which would have led a better understanding of a population in terms of data, in terms of intervention which is required. So you
hmm,
require the healthcare specialist into the
hmm,
VC forums is why? Because you want to solve the problems. The
hmm,
conventional thing is, as a technical doctor, what am I doing? I'm solving the problem. Can
hmm,
I do a larger scale up of any healthcare and solve
hmm,
problems? So we have to look for beyond the conventional ways of sitting throughout the day, seeing 100 patients without providing quality or not quality, and bring in a quality into the system. So we would love to have a VC forum to fund
hmm,
about how to make the disease understand. So in my
hmm,
OPD in AIMS, there were 300 people, and every single time on 300 people, if I see 50 people of aplastic anemia on a Friday, everything I have to tape record 50 times in a day. Will you
hmm,
be tired or not? Let the technology bring in where you
hmm,
create a videos and provide a solution. So you require the healthcare specialist as a technologist. So I take a clue from Microsoft. So
hmm,
Microsoft provides you the GST forum. Does it the coders develop the GST? They did,
hmm,
but they do
hmm,
understand anything about the GST? The answer to that is no. They have got the spectrum of chartered accountants who knows from page 1 to page 100. They can
hmm,
collaborate between page 100 between page 99 and page 80 and give you
hmm,
a complex solution, complex problem, a simple solution by a coding. So that's why the healthcare personals need to be the epicenter because they understand the uniqueness of a problem. And
hmm,
isn't healthcare a one single entity? It's a giant. It's a
hmm,
conglomeration of a problems.
hmm,
Hematologist is different from oncology. Oncology is
hmm,
different from a nephrology. Nephrology
hmm,
is different from anesthesia. Anesthesia is
hmm,
different from a preventive healthcare or a public
hmm,
health. So Dr.
hmm,
Bagai very well said of talking about the preventive and the public health. Public health
hmm,
does not collaborate with the third tertiary care. Public
hmm,
health has to be a continuum of a tertiary care.
hmm,
So understanding is once we understand the uniqueness and why the doctors has to jump in to solve the problems of the healthcare.
hmm,
Please, I would request all the doctors to be at the epicenter is why? Because you understand the problem and you
hmm,
need to partner with people like you who can bring the
hmm,
technologists on front, on
hmm,
board, and
hmm,
combining together, we can solve the problems. Second
hmm,
point, which I would like to say, why these kind of of forums are required because there will be unlocking of wealth. The conventional aspects of how the doctor sees in terms of establishing and taking care of the wealth management, if they solve a problem that is scalable, as Prime Minister Modi always says, our biggest asset is a population. So I think that technology has to be a integral part of a healthcare VC, and which is either driven or be a part of by the healthcare physicians at large to solve the larger problems in that, which will lead to all our goals, what Dr. Bagai has said, whether it be preventive, whether it be primary healthcare, whether it be publishing the data and so on and so forth. But the technology plus the healthcare is the right combination which we need to bring in. And understanding of the diseases is very, very important. So I give you one example. Onco.com is being founded by two medical oncologists and MBA. So the scalability, what I don't know, is being brought by you people. What you people don't know is brought by a physician, which leads to a problem solving. So understanding in a healthcare is the unique challenge is problem solution, which has to be by the healthcare for the people of this public and with the healthcare. So that's what I've written on a LinkedIn. This forum should be by the doctor, with the doctor, for the people of this country. Over to Urban.
Very well said, Doctor. I think you hit on all you hit on all the points, and some of the speakers before, they kind of tossed the ball in that direction. So absolutely, the value. I've seen myself in my own experience, solutions come to the market that really could have benefited immensely if they had just spoken to a practicing clinician, while they were in the idea stage. And it's not expensive to do. It's just the way you see things and they see things.
Absolutely right. Yeah.
Sorry, I also, so leading on from that, since we have established the need, the importance, and the value ultimately to all stakeholders, not only patients who are the primary stakeholder in terms of the service they get, but also on the commercial aspect, the investors and the technologists that are innovating. So we've seen the value that they all bring. My next question, and it's an open question. I'll probably start with Major General Jagtar Singh, which is, so that conventionally there are doctors in three sectors. You have doctors in the private corporate hospitals, you have doctors in the public sector, you have doctor entrepreneurs who have their own clinics and their own nursing homes and hospitals indeed. So I wanted to just ask realistically, how is it possible that doctors working in the public sector, in the armed forces in particular, because you've been the additional director of the Armed Force Medical Services, what is the kind of engagement that you see, or the framework that's available for doctors in these different sectors to get involved with innovation and startups, or even setting up innovation hubs in their respective places?
Okay. Urban, I would take this question in this manner, that while there is definitely a commercial angle to all the healthcare innovations, or the ultimate marketing, or the getting the commercial benefits from whatever you are innovating, but in the government sector, it takes on a little different color, because what happens is the resources are limited, and there are problems, of course, which we need to solve when we are delivering healthcare to our troops and their families. There are two issues. One, of course, the resources are limited. The second thing is that the healthcare has to be delivered in diverse environments. It is in peace areas and in field areas. Now the peace areas are our major stations where the Army, Navy, or Air Force is stationed. But as far as field areas are concerned, the problems are galore to deliver the healthcare right at the place where the troops are stationed on the LAC or LOC or on the border. So one is looking at solutions from technology, looking for solutions from the industry, that where we can, provide, better healthcare, more efficient healthcare, and more effective healthcare to our troops and their families. I'll give you one small example. Now, for example, we have to carry out field surgery right at the, sometimes at the just behind the enemy lines, or where the action is taking place. There, the soldiers, whoever is injured, the casualty is brought, and our, damage control surgery, or you would say life and limb saving surgery is carried on there. We have this field surgical team which is supported by an X-ray unit, and it is supported by a lab unit. So we had this problem of how do we get equipment for this field surgical, unit, the radio imaging and the diagnostic of equipment for the lab, how it can be rugged, it should be portable, and it should be light. And specifically, I will give you one example where, we had a lot of problem of, supplying these semi-automatic analyzers to these field units. They couldn't stand the, the handling or the journey to these places, and they would not work in those places. So what did we do? We reached out to the various innovators and industry, and we were able to come up like a portable lab, which we are now being able to use in our various field hospitals and field surgical units, and to give effective results and support to our field surgical team. So while the this angle, commercial angle, may not be the one which is so paramount as far as the government sector is concerned, but yes, to get the most out of the resources that we have, which is always scarce, and provide specific and to the point solution to the problems, unique problems that the government sector or the armed forces in particular faces, is always there. And that is where the healthcare innovation and healthcare technology and the digital health has come in. Thank you very much, and over to you.
Thank you, Doctor. I think that's very valid, highlighting the value of innovation beyond commercial. In many sectors, it is fundamental to the service that the government and even public organizations provide. So that's a very good insight. I think it's not always a commercially motivated innovation. Sorry, yes.
Apan, can I add a thing onto this?
Yes, please. Yes, please. Feel free, Doctor.
Dr. Singh, the major important thing is there's an incentivization beyond to any of the innovations or research needs to be there, whether it be commercial or whether it be the fame for being the country, doing for the country, either way around. The armed forces does everything for the name and the fame of the country, and that's a brilliant thing. So any research things needs to be incentivized, and we have to take the model from America. They first try to solve their problems, and trying to solve their own problems, that products becomes bigger than anybody else, which also fetches the incentivization and the commercialization. So making money is never bad, as long as you're solving the problems and you're making money by ethical means, is the way we need to change the outlook for the country. So any research or innovation needs to be incentivized either through the government, and in this country the government is the major player. I think that's a very clear message to the people should go, so that the brightest of the minds in the healthcare sector itself, as in IITs and the BITS Pilanis of this world are doing, the startup milieu, the healthcare as is incentivized and thought over, it will bring in the best of the minds. And this VC forums like this are the platforms which will incentivize the innovations, which is going to solve more and more problems, because it will push more and more people from a conventional model of delivering the healthcare to an advanced way of delivering the healthcare.
Yeah, absolutely, Doctor. Thank you for that
point there, Arpan.
Sorry, I just wanted to jump to Doctor.
Sorry,
Doctor. I just wanted to jump to Dr. Bagai, and then maybe we will come back.
Okay.
I've been meaning to ask him.
add something?
No, please go ahead. No, go ahead. Go ahead then.
No, I only wanted to say that the point that I was trying to make was not that commercial is anything bad or that. It is
Absolutely,
wonderful.
yeah.
But what I
Yes.
was saying is, apart from that, there are other motivations which is available for healthcare entrepreneurs to look at areas where they can make a difference and make a mark. That was all
Yeah.
I was saying. And some
Good.
have done it for the armed forces, and they are doing wonderfully well.
For sure.
That's
I mean,
what
a lot of innovation comes out of
Yeah.
the services globally, in fact, not just here. So we've seen a lot of innovation
If
come
we
out of that.
have time, I will tell you how the US Army handles it as far as their healthcare innovation is concerned.
Sure.
So that's a lesson for us, and we have been incorporating. Thank you.
Yeah.
I won't.
No,
take
well,
more.
point well taken, Doctor. So I've been meaning to ask Dr. Bagai, because you have this wide experience both as a clinician, as an administrator, as an entrepreneur. So your experience spans all of the sectors. And traditionally, doctors have been sort of investing in either opening a clinic or opening a medical center, as Dr. Bhargava pointed out, or even a hospital. Do you see a change on the ground with regard to the motives or the mindset of doctors with a little bit of savings to invest into technology, or even go further and found their own companies? We've seen in other industries professionals leave a professional practice and sort of found companies. Do you see more of that happening on the ground? And what is your advice to people who take on that journey?
Thank you. So just to give you a quick heads up, I've commissioned 5 hospitals in the last 12 years in Delhi NCR, and I'll share my first-time experience. First and foremost, I think the doctors have to be removed from the clutches of private healthcare players who practically suffocate them in driving targets with practically no interaction or role in decision making. So I think the senior doctors, at least, must be a part of the decision making in various structured manners. I won't go into those details. And the senior doctors must have an equity. Now, that's your sense of belonging. Now, you can have equity in various ways. Either it's a financial equity or sweat equity or performance-based equity. But I think some sort of incentivization should be there. The second is research and development, publications, and academics must be incentivized. That onus and that burden cannot fall on single doctors. I think the private hospitals and likewise government hospitals anyway are doing that. But the private hospital players must come forward for that. The next point is to understand the Indian diaspora. We have 75% of healthcare being private, but 78% of healthcare overall in India is still unstructured. So when I say it's unstructured, it's less than 30, 40, 50 bed hospitals in tier 2, tier 3 cities, or standalone clinics with 2 beds, 4 beds, in a manner which is at the moment not integrated. Now, the private sector GPs and other players who are much smaller in size need a little bit of government support to digitalize them. Now, the key which I'm coming to driving home is unless until we don't capture data, we get nothing in our hand. There's an old saying, give me a little bit of data, I'll give you a little bit of information. If you give me all the data, I'll give you the world. Now, data analytics and your next steps forward, not only from clinical management, but overall from an operational point of view, is actually based on data. Now, coming to a couple of points, and then I'll address your question directly. There's a WHO manual in late 90s, which actually the heading of the chapter is "To Err is Human," in which it was stated the third most leading cause of death in most Western countries, including US, 9 to 11% was the cause of death was human errors. So I think if technology can remove human errors and to bring it down to less than 1%, I think that technology is excellent for patients. Point number 2 is there are various technologies which reduce hospital-acquired infection, give you a 40% increase in clinical diagnosis in terms of accuracy, 42% decrease in readmissions because of wrong diagnosis, 50% better utilization of beds, concepts of EICU, I-suites, which is digital operation theater rooms, and so on. Very often you hear owners of hospitals say, I'm a digital hospital. And what do they have? What they've basically done is a basic format one of what we call as an electronic medical records, not even a complete medical record. That's not digitalization. I think we need to go into the depth. I'm not talking of going through the 7 stages of the HIM stages of digitalization. There are more than 128 portals of digitalization. So I think that initiation of information towards the private players who already are running hospitals or indeed want to build hospitals further, I think that's very important. Of course, e-consultation, one of the panelists has already mentioned, there is a 70% increase in e-consultations in worldwide data, which was published just recently in British Medical Journal. So I think e-platform is a great platform. What this technology also will do is it will link in the TPAs and the insurance companies. So all the insurance frauds, the delay in TPA clearances at the time of discharge will be eliminated. So typically a patient waits for 6 to 8 hours after being discharged formally by the consultant before the patient goes home. So you'll save a lot of time. The bed utilization in terms of your ALOS will become much smarter for the hospital. To link in the pharmacies, the most unregulated and unchecked, unmonitored segment is the pharmacies. So if you have a digitalization from a patient's point of view, what the Ayushman digital format is now being initiated, you'll be able to capture what we call as what kind of medication, what is the best medication for patients, patient allergies, drug interactions, contraindications. So I think it's a huge, huge movement which is now taking place, and all of us must initiate it, must be promoting it. Now, with regards the overall concept, I think what players need to understand is that whatever you are spending is not a spend, it's an investment. Digital technology gives you an ROI anywhere between 25 to 28%, which is more than your initial investment in setting up the hospital. So I think the doctors must take an initiative. There are various platforms now available in which doctors can interact. The biggest hurdle which a private player as a single entity has to overcome is his inner fear, his or her inner fear. They are fearful if they raise some funds, what will happen? There should be no fear. The first is to eliminate the fear, embrace technology. You will get the investments because this is a great phase which we are entering now into for the next many decades. And I have no doubt at all that this is going to leapfrog us into a great, great format for patient care. Last and most importantly is doctors must be a part of initiating, building, constituting, commissioning hospitals. They are the people who understand the pain. They are the people who understand the nuances of healthcare delivery system. They are the people who are on ground with the patients. They are the people who understand what's the best schedule of charges, what we famously call as rate list, which should be applicable, and they should be a part of the profit sharing of the entire chain. Doctors, when we say patient centric, I will go to the point of now saying it's doctor centric, because if you're not doctor centric, you can't be patient centric. Over to you.
Good points. Good points there, doctor. Good points. So I think leading on from there and sort of moving on from there, I wanted to ask Dr. Tripathi, and then I think we have time for very quick feedback from Dr. Bhargava as well. What I wanted to ask Dr. Tripathi was, I mean, doctors are seen as the custodians of patient care and the guardians of patient safety. So with that in mind, and what advice would you have for doctors or even innovators and entrepreneurs in the health tech sector? How do you what are the key things that they should be looking out for or being careful about that you see in your practice?
Just to add on from Dr. Singh and Dr. Bagai, I want to emphasize on the hackathon model of innovation, which was first adopted in Germany by Dr. Christian Hessler. And this model, hackathon model, is used by companies to facilitate the innovation part. And in this model, they bring to the table all the stakeholders, from patients to colleagues of the patients and hospital colleagues and other company representatives, to see what is the need of the innovation and how innovation can be better managed for the patient care. So from that model, we can the companies, and there is also marketing dividend from this model, which can be taken care of. And other part which I want to add on is that digital technologies which are highest impacting the outcomes and quality of care, uh, which already enumerated by Dr. Bagai, that clinical decision support systems, data supported decision making, robotic surgery, artificial intelligence, and patient care guidance platforms like remote, and then from remote monitoring, embedded biometric monitoring, and wearables and telemedicine. These are all conglomerate of innovative approaches which can help us in bringing about the transformation in healthcare. So, from the patient doctor point of view, we need to be updated by all these. You can say by these webinars, and you can say indirect approaches through CMEs, because in CMEs also throughout we are just going for the clinical part, but now with these innovations we need to do some CMEs on this approach also, innovative approaches also. So like we are it is very good first you can say approach to start an innovative approach by this physician VC platform, but vast majority of doctors are not involved. So we need to organize some CMEs on these aspects as well, because IMAs and all other forums need to at least give one or two platforms for these updated mechanisms, so that doctor like even general practitioners are even not very well informed about these choices. Only some modern setups and tertiary setups these are available. So we need to take these things to the general practitioner level also, and this can be done only by through large platforms like IMAs and our societies of clinical societies. We can also make a session dedicated to these innovative approaches, which is still not being done. So these are the other measures we can take, so that our fraternity learns and improves upon their outcomes.
Thank you, Doctor. Dr.
Arpan,
Bhargava,
Arpan, can I just add a quick line?
Yeah, please.
With your permission, thank you.
Yeah, of course.
I think the next few decades would actually belong to sensors and devices, home monitoring, home tracking. I think there's an enormous waste of time, money, and energy and space in patients traveling up and down. Very often, the visits are actually just for monitoring a particular event. But I think sensors, be it wearable, ingested, embedded, and there are various other technologies which are now already even in the Indian diaspora available. So I think sensors and devices is a huge role. To give you an example, there is a hospital known as MIC Hospital in Berlin. It's a 100-bed minimal invasive surgery hospital, and it has only 17 nursing staff. That's the level of digital transformation in which the human part of a person going in and out of rooms trying to monitor things is actually eliminated. Next very quick point is I think AI is already there. There are various models which are available, not only the Watson model of IBM, but there are various other AI models now available in the Indian platforms. But I think AI genomics is going to be a huge role. We find it very difficult for people to make them understand and realize that a patient on 3 antihypertensives, very often patient on dual or triple anticonvulsants, the medicine is not going to work because at a genomic expression level, those drugs are resistant to the gene. So there is no point in pushing in more and more number of medications, whereas a simple gene test will tell us whether the patient is sensitive to a particular group of drugs. And last, most importantly, is what this technology of digitalization actually gives is accountability. Accountability has 3 important parts: standardization of healthcare and procedures. That means the same procedures across the length and breadth of the country should follow a similar format. Point number 2 is quality. You have to ensure a minimum base quality, which is lacking very often from one chain to another chain, one town to another town. And third, most important, is patient safety. You can't have a patient suffer because of hospital-acquired infection or a lack of care. Very often, these points are never highlighted, never captured, but the technology of this kind of platform will actually ensure that we give patient safety a very core importance, because The end point is that the patient has to go home without complications as quickly as possible. Over to you.
Thank you, doctor. I think I just about have time for one question, Dr. Bhargava. And I mean, do you had something to add, and then I'll go on to the question. Anything? I need to wrap up in 5 minutes. Yeah.
Yeah. So the simple thing is, to all the doctors and all the collaborators, the doctor needs to be a part of a healthcare innovation.
Yeah.
Find out a problem, a need gap for the country to make a better place to live in.
Yeah.
How can we survive longer without coming to hospitals? How can we live normally by preventive care strategies? That should be the aim. If the aims are simple, the goals are simple, you will keep on innovating. We understood that in the periphery like Gorakhpur, Bareilly, the biggest problem of blood cancer has not been picked up is because the technicians could not identify the blast. And that's how the technology was brought in, where every third day we are finding a new leukemia, which was getting late because of this technical problem. So identify in this country, we can't leave this country. We are very big part of a country. So now, once we have understood this fact, let's try to make this country a better place to live in. Please find the need gap. Find the right collaborators, whether the doctor initiators or the technology collaborators with the doctors, but find a solution to our problems. And whatever the goals have been set by Dr. Bagai, Dr. Tripathi, we will all achieve that aims. But the bottom line is, please try to solve the problems through this VC physician forums, because that's a way where we can scale up, we can standardize, and we can deliver better and make a society and a nation a better place to live in.
Thank you. Thank you so much, Doctor. Very, very, very well summarized, I think, all of the points that we tried to cover. I have we have a couple of audience questions, but I think we have about 5 minutes for maybe 4 minutes for a couple of questions that we had. And one of them was addressed to Dr. Bagai, but I think I'll leave it open for anyone. It's regarding regulations. And what can innovators do to better understand the regulatory framework? And maybe you can extend that to say that does it foster innovation? What can be done? Very, very quickly, just couple of minutes.
Yeah, so just very quickly, I think if the device itself is now taking shape of a new industry. So I think each device, each format, be it a drug, be it a device, be it a sensor, be it an implant, has specific regulations, specific guidelines, and specific monitoring. So I think it's important from the industry point of view and doctors' point of view that compliance is critical. I will stress on this again. Compliance is critical, because if you don't follow it, very often you'll end up with complications.
Are there gaps in regulations, doctors?
Yeah, Dr. Bagai, just adding to it, is the VC forum has to be a bi-directional thing. As they're educating the doctors, they also need to educate the policymakers for a newer industry, and they have to prepare the industry to accept the innovations as well, and to make it much more less complicated, less red tapeism, removing out the bureaucracy, because it's a new territory. So VC forums like this has a bi-directional role, both the doctors and the regulators.
Thank you. Thank you all so much for your time. I think I'm going to ask Sachin for to pass the message on to regulators, because we've addressed our side of the problem.
Sure. That point is very well taken. And there are forums where we interact with policy makers, not only in India but in Singapore and other countries also. Will definitely like to bring this thing to their notice. And one of the positive things is the current regime is more open and receptive to ideas and innovations. And just now at the starting of this forum, I was talking about launch of digital Ayushman Bharat, the announcement which was made by PM
That
Modi.
is a very powerful signal, the universal ID, unique ID for patients.
Yes. So I think so we'll have a much more conducive environment for healthcare innovation in coming days in India and globally. So one of the key messages which we gather from today's panel discussion is the key is collaboration. The innovators, whether they are IITs or some other stream, they need to collaborate with doctors, because doctors are so this is very much established that doctors are at the epicenter, and so various folks who are here and there, they need to kind of work closely with doctors to understand the real problem and solve that problem, working with the doctor. Yeah. So that's great. So thank you so much, all panelists,
Thank you.
stakeholders who have joined us from across the world. Also, this forum is going to be a weekly forum henceforth. So we already have a topic for the next week. Next Saturday, same time, we'll be rejoining on this forum, and we'll be having 4 successful doctor entrepreneurs who have established some of the leading health tech companies in India. So looking forward to see you again, and thank you, everybody. Thank you. Bye-bye.
Thank you, Dr. Singh, Dr. Bagai, Dr. Tripathi, Dr. Bhargava. It was inspiring hearing you speak on something that when I was a student, I did not hear my professors and lecturers speak about. So it is extremely inspiring.
Thank you.
Thank you all.
Thank you. It was a pleasure to be part of this.
Thank you.
Okay.
Thank you.
Same here. Thank you.